In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And here to talk to us about the common cold is our guest in the studio, Dr. Sabine Beck from the Department of General Medicine at the Charité Hospital here in Berlin. Hi, welcome to the show. Dr. Beck, I'm a GP by myself, and I'm very eager to hear all the new university research things going on about common cold, coughing, and upper airway infections. So the first thing is, there's an old saying, a cold takes 7 days to heal if you don't see a doctor, and if you take some medicine, it takes a week. So that's roughly the same, isn't it? What's true about the saying?
Well, if you ask university medicine and all the studies, all the research that has been done into common colds and their treatment, you actually come very much to a similar conclusion that there is not one medication that really helps you to alter a common cold very much. I myself would prefer to give it a little bit more time than just a week for the cold to resolve completely. I already also know the saying, cold comes 3 days, stays 3 days, and goes away 3 days. So that gives you a little bit more time to completely recover.
But why is it so difficult to treat the cold, actually? I mean, we are flying rockets to Mars, we are building nanocomputers. Why is it so hard to treat the common cold?
The common cold is not a very basic illness because it can be caused by a lot of different viruses. So it's actually a lot of different illnesses in one illness. And nature itself is actually quite good at healing a cold. So if you look at it, you get a complete recovery without any severe, long-lasting complications. And nearly 100% of all affected people, you don't have any side effects, you don't have any costs. And so you have to have a medication that's a lot better than that. So that's not easy to do.
That's very hard to find, isn't it? Yeah, right. And what about the immune system? Is it useful for us to boost our immune system in just getting a cold, like training for the cold in getting it, going into a crowded bus and catching all those viruses? I
wouldn't myself expose voluntarily to a common cold, but perhaps it helps you to accept you have one once you have one, that you say it's good for the immune system to do a little bit of work. We know that the human body is not made to live in a sterile environment, so it has an immune system, and perhaps that wants from time to time to do something. We know, for example, that children that have lots of infections or that live on farms and have contact to farm animals, that they get less allergies because the immune system is always working.
Okay, and I mean, catching upper airway infections and the cold, it's easy to catch those if you're in the crowd full of people. But what about going outside into the cold? Being cold, does it lead to getting the cold?
Well, the cold doesn't cause an infection. It can if you get too cold, if you're not properly clothed. You probably are more prone to catch an infection because your immune system doesn't work when you are not close. You don't have enough clothes. But you can always catch a cold in summer on hot days.
Okay. And the cold is something very different to the flu virus, influenza. Influenza is a deadly disease, sometimes deadly disease. It's a very serious disease. How can patients differ between both the cold and the flu?
Yeah. Well, if you as a patient get the flu, you will probably notice that it's not a common cold because you get a very high fever, you feel really sick. Even if you're a young and fit person, you will lay down in bed and will not move from there for quite an amount of time. So you will notice it's not a common cold, it's really another infection, an infection that's caused by the influenza virus.
Okay. Thanks for that, Dr. Beck. We're talking again against the cold. But we got a lot of viewer questions, like Lubaid Al-Abwat, a viewer from South Africa, was told not to do any sports while being sick with a cold. Is it dangerous to do sport?
Well, it's certainly not advisable to really do an exhausting sport and do tough training when you have got a fever and when you have got a cold. But on the other hand, you wouldn't need to lie down in bed and not to do anything. It may be good to just go for a short walk if you feel like it, have some fresh air, and that is not dangerous at all.
So it's more like common sense when to stay in bed and when to get outside.
Yeah, it's just like listening to your own body. When your body tells you, I've got a fever, I want to lay down, you can do that if you feel like going out.
Okay. Josephine E. Andreasen from Kazakhstan asks, how long is a cold contagious?
Well, a cold is contagious for as long as you have the cold, and it is even contagious before you even have it or before you notice you have it. So that is probably the time where you can't avoid exposing people to the virus you have in your body. It can be helpful if you have a cough, to cough in the elbow, because then you don't spread the virus via your hands when you greet somebody.
Okay. And Ivo Duvnjak from Croatia says he gets a painful sinusitis, a sinus infection, whenever he has a cold. What should he do?
Well, he should go and see a doctor, because it's certainly not a good thing to get with every common cold you catch a sinusitis. And it's not normal. It can happen from time to time as a complication, but if you get it every time, there's perhaps an allergy that's not detected yet that might cause that you get these sinusitis again and again.
Okay, so with repetitive sinusitis, you need to see a doctor. What about coughing? If you've got a cold and you've got a nasty cough, do you need to see the doctor, or can you treat this by yourself?
Well, a cough is just a normal symptom of any common cold, and it can also last a lot longer than all the other symptoms. So perhaps the runny nose is over, you don't have fever anymore, but you're still coughing for 1 week, 2 weeks, even 3 weeks. It's still just a normal cold.
And you don't need to be too concerned about this?
You have to have a little bit of patience, and but you don't actually need to see your doctor for that.
Okay, and the pharmacies are full of cough expectorants and cough blockers. Are they useful to go to the pharmacy and get some tablets, or can you do this by yourself?
Well, all these tablets are not really proven to help a lot. All these expectorants, all the cough blockers, they are not of much use, and they are costly. So if you want to do something, you can try to drink a little bit more to help to make the mucus easier to cough up, but you don't need to spend your money on any certain medication.
And if you got this tingling sensation up your nose and up your throat, and you know, oh gosh, a cough is starting and a common cold is starting, can you do anything to prevent it from coming?
Yeah, you can try perhaps to relax, to start being a bit more quiet, and to give your immune system the chance to fight against the virus. But even in this situation, you wouldn't need to buy any medication.
So just slowing down and accepting that we sometimes get a cold. It is.
Yeah.
Okay, thanks, Dr. Beck, for being with us in the studio. Thank you.